Hi guys, welcome back to Biology with Mary Nyosk. Now today we're going to discuss on the first aid skill training. Now we're going to discuss about the first aid during burn. In case you've been burned, what you're supposed to do. First thing, when you see a person has been burned, if you are either a parent, a friend, or even a stranger, you're just there for helping. Do not panic. If someone has been burnt, be confident enough, take that courage, and with the skills that I'm going to give you, you can be able at least to prevent someone from being much in pain before going to the hospital. So first of all, you're supposed to identify whether the type of burn is either a major one or a minor one. Now I'm going to tell you the differences between the major burns and the minor burns so that you can be able to tell whether it's a serious burn or it's just a small burn. Someone can just treat themselves in the house without going to the hospital. So let's begin with the major burns. Now, first of all, a major burn always affects the inner tissues. Now it's so deep. Like if that person had been burnt, you can see the inner tissues or beneath the skin. So if you see that, then that person has been seriously burnt. The second thing is check the color of the skin. Now, most of the major burns have either a white skin or black skin or a brown skin. You can either test the size of the burn using either the palm of your hands or even the palm of your feet. Now, you can just approximate using the size of the palm and test whether if the area that has been burnt extends the palm of your hands, then definitely that burn is so serious. So what you need to do is to make sure you cover it so that any infectious agents cannot get into contact with it, and rush this person to a hospital. Alright, if it's a major burn, make sure that this person keeps breathing, because if it's so major they can have shock and that may bring about cardiac arrest or something. At least make sure that this person is breathing, and if they're not breathing, try to at least take some preventive measurements that are required to help that person breathe. A major burn can be somewhere maybe around your buttocks, around any private parts. That can be serious. Rush that person to a hospital. Now, the minor burns, they're not that serious. You find that the area that has been burned is not much wide. Like it's less. When you test it using the palm of your hands, it covers a shorter area. It does not extend that area. Majorly, in a minor burn, the color just turns into red, the color of your skin, just because you've touched your skin with anything that can cause burning, like a lamp or something electrical, even a gas, something like that. Then you can also check whether that person has been burned somewhere else. There are areas that are so risky. Now, if this person have been burned in areas that are not risky, that's not serious. In case you find that you have a blister on your skin, a blister is the occurrence of something that is so watery, and I've been in that situation. It always disturbs you a lot. Like you feel like you want to press it and break it. So you've just been advised, don't break a blister. Don't let it just break itself, but don't force it to break. The main reason as to why you are not supposed to break the blister is because you're going to damage your skin more, the cells more, when you break it. And that also can expose your skin into other infectious agents that can lead to other diseases. Because some bacteria might get in, fungi, protozoans, and lead to more damages. And in case you find that you've broken it, okay, don't worry. Wash it with running water. You can use soap, as soap is a disinfectant. It's something else. Okay, you can also apply, not for all cases, depending on the depth of burn. If it's a minor one, you can apply some ointment, but not all ointments, especially something like aloe vera, and try to choose the best ointment for aloe vera and apply it, because aloe vera is so medicinal. It can help you, and it can help your skin to dry very fast. And immediately cover it. Why? Cover it not just with anything, but use at least a clean clothing or a bandage. If you have a bandage, then cover it nicely. Normally when you're burnt, the tissues are damaged, so your inner tissues have been exposed to the outside environment. And remember, we are surrounded by a lot of infectious agents, so that's why your skin is always covered. So when your skin has been exposed, make sure you cover it to prevent yourself being infected. If you need to rush this person to the hospital, first of all, is a term known as rest. If that person has been seriously burnt in the hands, you're supposed to at least tie this person such that the hand can rest. Don't leave the hand to slant, because that's putting a lot of pressure on the hands, and inactivate your hands by tying it like this. The same way people always put bandages around their neck and hand, so that the hand can remain at rest. If it's at the foot, make sure that this person has sat in a way that they are so stable. Let them sit down. At least by sitting down, the leg will be relaxed, and let them put the leg straight at rest. Now that you've been able to identify whether this type of burn is major or minor, now the next thing you're supposed to do is now begin your first aid. First of all, make sure you clean that place with running water. Clean it with running water. The purpose of doing that is so that you can be able to cool that area, so that the heat cannot extend burning to other cells. Okay, so clean it to cool it. Okay, there is do's and don'ts. Like, there are people who tries to get flour. Actually, when I was young, my mom used to tell me to apply gel, I think glycerin. Apply it. There are people that always say that it works, but it's better for you to use running water. Just use running water, it's safer, because you can apply some gels, like maybe petroleum gel. Of course, that is going to explode the heating. It's going to increase the heating, and definitely that can cause septic shock. Other people tries to look for ice, and then you apply your ice. Okay, don't apply your ice, because again, too much cold is not necessary. It's not going to help. It might even create more problems. Remember to remove jewelries that can be around the area that has been burnt. If you've been burnt on the neck, remove the necklace if that person have a necklace. Remove jewelries or even rings if you've been burnt in your hands. Then if that person has a lot of pain, they can use pain relievers just to relieve that pain. And if it's so serious, remember, take that person to the hospital for better treatment. So thank you guys for watching this episode of first aid skills training. So hope you've enjoyed. Make sure you like, comment, subscribe if you've not subscribed. Keep tuned always, and remember to give me thumbs up always. Keep tuned for more and more videos such as this. Thanks guys. Bye bye. Peace.